Ontario is making major changes to how it treats people suffering from drug addiction. The province is banning supervised drug consumption sites near schools and childcare centres and stopping any more of these sites from opening. The move will force more than half of the supervised injection sites in Ontario to either transition to treatment centres or to close.
Continuing to just enable people to use drugs is not a pathway to treatment. And I believe that our government is offering a solution to our municipal partners who, I will say, have been asking for many, many months to have pathways into treatment, to have pathways so that our neighborhoods don't become just a place for people to use drugs.
The CBC's Lisa Shing has been following this story for us. She joins us from Toronto. So Lisa, can you walk us through the changes?
Hey there, Catherine. Yeah, so we just heard a little bit from Ontario Health Minister Sylvia Jones in that announcement about what exactly was planned, the changes that were planned for the province. So essentially the province is banning all supervised consumption sites that are located within 200 meters of schools and daycare centers. So what that means for the sites that are open right now are 10 out of the 17 sites in Ontario will be closing. So that includes 5 in Toronto, 1 each in Ottawa, Kitchener, Guelph, Thunder Bay, and Hamilton. So the big takeaway here, though, is that the province is banning any new sites from opening up. So the ones that are shutting down will not be able to, say, open up outside of the 200-meter zone. So the province is shifting away, it's saying it's shifting away from supervised consumption and moving towards treatment. So with that, it announced a $378 million for treatment facilities with various services, including primary care, mental health care, addictions services, social services too, and 375 supportive housing units. So it says some of these supervised consumption sites that have to close are able to apply and present a proposal to the province to transition into one of these treatment hubs, essentially, but they will not be allowed to offer consumption services or even needle exchange programs. Here's a little bit of what Sylvia Jones, the health minister, had to say today.
The status quo of drug consumption sites is not working. We also know that the cycle of addiction is not being broken by using drug consumption sites. We need to do more to support a journey into treatment and recovery, to keep communities safe, and to address the tragic impact of substance abuse, drug overdoses, and opioid-related deaths have in our communities.
So the province did announce a review of these sites last year after a woman was hit and killed by a stray bullet outside one of these sites in July of 2023. So in that, the province is also announcing that there's going to be more measures to enhance safety around the sites that do stay open.
And what has the reaction been to what are some pretty significant changes, Lisa?
They are significant changes, Catherine, and there's a lot of anger, especially among workers who are on the ground every day working with people who are dealing with addictions. I spoke with some of them who say these are life-saving sites. They prevent overdoses, they prevent deaths, they prevent people from catching diseases as well. So there's a lot of anger in the community saying that there needs to be services that not only help people with supervised consumption, but also on the treatment front. So while that treatment aspect, the big injection of money into the treatment is welcome and applauded, it's not a way to do it if you are also at the same time closing supervised consumption sites. So here's what one worker had to say about that.
Closing of sites will be an absolute catastrophe. We've been in an emergency for over a decade with the toxic drug supply that's getting ever increasingly volatile. We have one person dying a day every 2.5 hours in the province of Ontario. We've seen a doubling of deaths over Ford's terms. Supervised consumption sites are not the issue. Supervised consumption sites are just one part of a solution to managing the crisis that we're in.
So I also spoke with a mother whose son died of a fentanyl overdose a number of years ago, and she says while she completely understands the need to have these sites away from childcare centers and schools, she says they are crucial to have, if not a bit further away, because they provide life-saving services to people who need them.
Okay. Thank you very much for bringing us up to speed. The CBC's Lisa Shing in Toronto.
No problem.
Right now, we did ask Ontario Health Minister Sylvia Jones for an interview about this new policy. Her office said she was unable to join us. But for another perspective on the changes announced today, Doris Grinspun is the CEO at the Registered Nurses Association of Ontario. Hello.
Hello, how are you?
I'm well. Now, you describe this move as a death sentence for people that use substances. The minister, though, says that the lives will not be lost here. People are going to receive treatment. How do you counter the argument she's making?
So first of all, and the minister knows this very well, and let me tell you, I put the accountability on the premier on this, not on the minister. She's the messenger. They know very well that not everybody is ready for treatment. So those people will be using substances in the streets of our communities. It's a death sentence for them because even needle exchange the hubs will not offer. The hubs will not offer safe consumption services, will not offer needle exchange, and will not offer all of those aspects that keep people alive today. People take many, many years and sometimes never they're ready for treatment. That doesn't mean we don't save their lives. And they will be injecting in our communities. So what you will see is in the naked eye, you will see people lying in our communities, as the one you're showing now, injecting in the street, injecting in McDonald's, Tim Hortons, schoolyards, etc. And you will see more infections also, because if you don't have needle exchange and people are using drugs in the street, they exchange needles because they cannot purchase needles, which the safe consumption services were providing also.
So let me ask you.
You will see more HIV, you will see more hepatitis C, and that will cost a fortune to the public in terms of taxpayers' dollars.
Undoubtedly, part of the reason that the Ford government is going ahead with this move is because they have heard complaints. I mean, you point to that footage, you say you see people lying there like that. Some of that is happening right now. And in particular instances, people are saying there is a supervised consumption site near my schoolyard. We have to go pick up needles before the school day begins. There are serious concerns about safety around some of these sites. So what do you say to people who say, well, listen, I think that problem already exists right now, and the current plan, the word the minister used today, the current plan is enabling people to use drugs. It's not a pathway to treatment.
So that is Poilievre's approach, quite frankly. We are very, very sad that the premier has decided on this issue, very different than on trans people. He decided here to align with Mr. Poilievre. That is their approach, that is their wording. It is not the case. You will see this multiply by 100 because everybody that is using substances now in safe consumption sites, they will be using it in the street. So you will see more of it, not less of it. So it's not enabling. Many people smoke, including our premier. Well, it takes time to want to quit something. It takes people to support you on that. It takes not stigmatizing that. So we are stigmatizing it more, and it will cost more. And if the issue was we don't want it near to our schools, fine, we have no issue as nurses. Tell them to move. But they're shutting them down at the same time that they're prohibiting to open new ones or even to apply. And on top of that, they're putting a gag order that the minister forgot to mention today, but it is in their press release, to even advocate for that for municipalities or for a public health unit. A gag order on a public health issue. Can you imagine what that will do to public safety? What else they're going to do a gag order on?
The minister argued today that they're not closing these centers because they have the option to transition to these new kinds of treatment centers.
But the hubs don't have safe consumption sites. The hubs, the minister is very clear. It's in their press release. The hubs have no safe consumption service. have no treatment, and have no needle exchange. So they can open. We support the hubs, but the hubs don't have these essential services to keep people alive and to keep these disinfected needles out of the streets. They will multiply. You will have what you have in the US, and you will have it multiplied by likely 20 times more in the next just year, and later on by 100 times more.
So let's turn this on its head for a moment then, because again, you talked about, you see this as using the politics of Pierre Poilievre. I want to go back to the citizen or the parent who walks down the street and says, what is happening right now is not working. You obviously don't agree with many of the moves that the Ford government announced today. What is a better path forward?
A better path forward, and this is what we had asked the premier, and I had spoken with him, and we brought people that use substances to speak with his team. A better path forward would have been, you continue with safe consumption sites. Yes, if you don't want them near to schools, let them open somewhere else, and you create these hubs to support people so that they have all the supports needed to start to actually tackle the situation of mental health, if it's mental health, of social services, of housing, but you don't close an essential services. What are we going to close next? Are we going to close cancer treatments because people drink alcohol and alcohol produces cancer? Are we going to close them? Like, this is nonsensical from a public health perspective and from an evidence-based perspective, which is what nurses address.
Minister Jones today, when she was making the announcement, made reference to British Columbia's move to back off in large part its decriminalization plan. Obviously, you do,
right?
Yes, and so what I do want to know is whether you believe, and that's an NDP government. Here you have a progressive conservative government.
Yeah, but in large part they're not closing them.
True. But what I would like to understand is whether you believe that the political tide is perhaps changing around this issue in the country, that there is more and more pushback against some of these measures.
No, I believe that this issue will probably cost the government their seat here in Ontario. No, you're wrong.
Tell me more about that.
You're wrong, because by the time that there is elections also federally, people will be more and more lying in the streets. There will be more EMS ambulances will be busy with transferring people from the streets to the hospitals. Emergency rooms will be even more busy than now. It is a disaster. It's a failed policy. I am not surprised that Mr. Poilievre is speaking about that, as he is speaking about, trans and all other kinds of extreme far-right issues. I am very surprised, that Premier Ford is moving to that direction. Very disappointed.
Are you truly very surprised about that, given some of the discussion? I think, for instance, of that mother who was killed by a stray bullet in Toronto. You find this shocking?
Yes, one mother, and I feel terribly about that, Here we will have, we already had last year, 4,000 people, 10 per day, dying from toxic drugs. Toxic drugs, that's what is being sold in the street. You will have all the traders of drugs, the drug dealers, they're in heaven today. They are thrilled. They will be able to sell more toxic drugs that will be in our streets, and you will see the disaster that this policy is, as it is in the US, and people don't even want to go to some places on vacation because they cannot see any more people in the street the way they are. So no, this is a failed policy, both financially, in economic terms, because will cost in HIV treatment because of the needles that will be there in the actually school years of kids. Unfortunately, the needles that people use at night or in the evening, and you will see, just so you know, $1,800 as a nurse. I'm telling you, the treatment of choice for HIV per month, multiplied by a year, multiplied by 40 years, just for one person, that's what it will cost the province. You will have more HIV, more hepatitis C, more unsafe streets, way more than now. I'm not saying what we had was perfect, but closing the safe consumption sites where people went into a place to inject substances is not the way to do it.
I really appreciate you making the
ideology.
Thank you very much for making the time to speak to us about what is a very important issue. Appreciate it. Doris Grinsman.
Thank you.